Okay, good afternoon. Very warm welcome to this workshop session on integrative medicine. I'm so glad that we have this session in the World Health Summit. My name is Amir Takian. I am from Tehran University of Medical Sciences. This session is supported by Tehran University of Medical Sciences and the M8 Alliance, which is the think tank for the World Health Organization. As you know, more than 88% of the WHO member states use traditional medicine in different ways. The definition of traditional medicine, which is a kind of part of history, is the sum total of the knowledge, skills, and practices based on theories, belief, expectations, and experiences indigenous to different countries. There is another term which is called complementary medicine. For instance, Chinese medicine in China is traditional medicine. But when Chinese medicine goes to the United States and it's being used by people in the United States, which is not a part of the conventional or the indigenous way of practicing medicine, this is complementary medicine. There is another term, as you know, which is integrative medicine. Our session is mostly about integrative medicine, which means that the way that we are nurturing complementary and traditional medicine align with the conventional medicine to provide services for people to reach universal health coverage. And that's why the World Health Organization, in different documents, including the declaration adopted in Astana at the Global Conference of Primary Healthcare, refers to traditional and conventional medicine. And the World Health Organization has started a big global initiative in order to foster traditional and community medicine, and complementary medicine into the health system of various countries. This session is about universal health coverage. This session is about patient-centered care versus system-centered care. And one of the options, one of the choices that citizens and patients have is complementary medicine. Despite all this emphasis and highlights, the thing is there are some challenges. And those challenges refers to regulation of complementary and traditional medicine, the education of workforce for traditional medicine, the way that people perceive traditional medicine, and unfortunately some malpractices, the funding for traditional and complementary medicine and these kind of things, and the uptake and the way that we can balance and integrate traditional medicine and complementary medicine into the conventional or Western medicine. This session is about it. So what we are going to do, we have a line of fantastic panelists with me from the World Health Organization to countries who are pioneer in traditional and complementary medicine to some policy analysts, and from the civil society. We are all together here this afternoon to discuss about how integrative medicine is essential for reaching globally universal health coverage across the world, and how we can actually foster the good and healthy embedding of integrative medicine into the healthcare system to reach universal health coverage. We have 6 speakers with us today. So the way that we divide is we have the first round of 5 minutes intervention each, and then we take questions from you. Hopefully you have some questions. If you don't have questions, I have more than enough questions to ask these fantastic panelists, because it's very difficult to get hold of these people. We have 2 panelists online, Professor Dennis Chang and Professor Shams, whom I introduce in a minute. But first, I'll introduce each of the panelists when it comes to their turn. Without any delay, I would like to ask our first panelist, Dr. Shomaya Kurovila. She's known to everyone who is active in traditional and complementary medicine. She is the senior strategic advisor at the World Health Organization. She was the person behind the global summit that WHO held just a few months ago in August in India. And she is the lead for traditional and complementary medicine at the World Health Organization. So why not starting with her and listening how, Shyam, thank you very much, Shyam, for accepting our invitation, and tell us why, on the basis of the experiences and on the basis of the WHO Constitution and your general program of work and all the strategic dimensions that you have, why integrative medicine is essential to reach universal health coverage as WHO advises. Please.
Thank you so much, Amir. And colleagues, I hope it's okay that I sit down. Amir said we'll have more of a discussion and an interactive session, so I hope you're able to see me if I sit and talk from here. So one of the questions that we have gotten often is, why is WHO suddenly paying such a lot of attention to this area now? Actually, WHO has had traditional complementary integrative medicine as a focus since 1978, with resolutions as well. But now there is a scaled up interest and a need to build WHO's capacity in this area. And there are a few reasons why. So, WHO Director General Dr. Tedros said, as Amir just mentioned, in over 80% of WHO's member states and countries, people are using traditional medicine. For some, it is their only source of healthcare. For others, now it is a preferred source of their health and well-being needs. So, at the Charité in Germany, there was recently a study that found that 70% of patients, even in oncology units, for example, wanted the option to use some sort of integrative complementary medicine. And in countries like Ghana, over 70% of the population uses traditional medicine. So this you will see in every region of the world. And it's also something that people, is a resource of the people living in each country. Their natural resources, the knowledge that's been passed down through generations. And it is the role of WHO to ensure that there is an evidence base, that there's a respectful exchange of knowledge with indigenous communities, with traditional medicine, so that everybody is learning. It's not, and sometimes we have to evolve that way. There is also, after the pandemic, a need to look at approaches that balanced the health and well-being of people with the health and well-being of the planet, that we're not going out of sync, and traditional medicine has those learnings and wisdom. If you look at the industries growing around wellness or herbal medicines, you'll see that these are multi-billion-dollar industries, and as Amir said, often not regulated. And again, there's a need for safety, for efficacy, for evidence-based practice. In systems, you'll see that countries right now, WHO is doing a global survey with every country. By November, we should have the results in. And this is looking at how countries organize their traditional medicine and complementary systems. And with some, it's actually co-located with primary healthcare in primary healthcare centers. In others, it's more of a choice. In some, it's not covered by insurance. In others, it is. So it's quite a mixed picture. And Amir also mentioned in terms of education. Is it the same practitioner who learns, conventional medicine plus others and practices it, or are they two complementary workforces? So it'll be very fascinating to see what's the update in the survey. And there, as again Amir already mentioned, there are political agreements at the level of heads of state, whether it's the Universal Health Coverage high-level meeting that was in September at the UN General Assembly. There's a mention of a commitment to focus on traditional medicine in an evidence-based way to ensure safety efficacy. There's also the PHC, the Convention on Biological Diversity, the rights of indigenous people. So there are lots of legal, political, leadership agreements. And my final point on this is really about the opportunities of science and innovation to really leverage this knowledge and make it available. And it's important to also realize, for example, that 40% of our conventional pharmaceuticals, so I'm not talking about herbal medicine, are based on natural products. But science, WHO has gotten a lot of criticism sometimes saying, oh, you're going soft on science by focusing on traditional medicine. But it's actually saying no, like any other intervention, the same rigorous standards of research will be applied. But we will be hard on science in applying it to traditional medicine, but also hard on science to say, do we have the right scientific methods to understand something that's personalized, that's something that's holistic? Or are we still looking at, say, randomized controlled trials that are designed to look at one active molecule, or one pharmaceutical product? So we have to be hard on science in terms of saying, do we have the best ways to understand our world and the knowledge that's in it in a respectful way? So this was a brief introduction about why now And then what we do next, I think we'll discuss once the discussion goes on.
Thank you very much, Shamaya. This is the very comprehensive picture and the commitment that the World Health Organization has and the member states. And of course, what she mentioned is about the diverse stage of progress in terms of integrative medicine across different countries and the way to foster that if we think that this would be beneficial, which is the case for many countries. So thank you very much for setting the scene. For the next speaker, I would like to invite Dr. Dong, if you can, for the stage, we have some presentation. One of the pioneer examples of traditional medicine, of course, is in China. And Chinese medicine is known to everyone. So we are so pleased today that we have Dr. Dong with us. As you know, she is the member of the China Academy of Chinese Medical Sciences, Deputy Director of the Cardiovascular Department, and she is at the, I hope I pronounced it correctly, is it Zhiyuan?
Yes.
Okay, I corrected it. Zhiyuan Hospital. So she is a clinician with very comprehensive research background in terms of cardiovascular diseases. So she's going to tell us how China is embedding this approach for at the larger scale, along with other approaches to regional resource coverage. Dong, please.
Okay. Good afternoon, dear friends. It's my honor to be here as a representative of traditional Chinese medicine. T&CM has existed over 2,000 years, and the fundamental reason is the clinical effective and safety. But in an era dominated by evidence-based medicine, shall we insist that being is reasonable, or shall we advance with the times? So I'd like to take COVID-19 as an example. In 2020, Wuhan outbroke COVID-19. I was one of the members of the first national T&CM team to support Wuhan on 25th of January, which happened to be the Chinese New Year. On the train to Wuhan, our leaders had such discussions and reflections. T&CM has made significant contributions during SARS outbreak in 2003, but because of the lack of clinical trials, the efficacy was not recognized finally. So this time we cannot repeat the same mistake. We should conduct the clinical research while treating the patients. So we really did a series of clinical studies, including prospective RCT, retrospective cohort study, real-world study, and system review. And last, our achievements were recognized by the World Health Organization, and the T&CM benefits many overseas patients. We are really proud of that. But we also have confusion. I think almost T&CM may face such confusion. We are unique. We are different from modern medicine. So sometimes it is very hard to present clinical efficacy by using modern medical efficacy evaluation method, which cannot reflect the inherent characteristics of T&CM. Also, to go to the world, we need a clinical cooperation platform. So in February 2023, China Academy of Chinese Medical Science built a registry platform for clinical trials of international T&CM. And this is a website, and that is my email. So you can contact me anytime. We are really looking forward to cooperation. Also, we hope T&CM can be recommended into the international guidelines for some diseases that we do have therapeutic effects. So, and last, I have some personal suggestions. Focusing on some advantageous disease or some stage of a disease, and seeking global multi-center cooperation to produce high-level clinical evidence. And we should apply an integrative efficacy evaluation system, which not only meets the requirements of the modern medicine, but also reflect the inherent laws of our T&CM. And I really hope in future our T&CM can develop hand in hand. And that's my speech. And best regards to everyone. Thank you.
Thank you. Thank you, Dong. I'm sure that we have all opportunities to learn from Chinese experience, given the scope and the magnitude of the practice in Chinese medicine and traditional medicine, which we come to that in the second round with Dong as well. Let's go to Australia. We are so pleased and fortunate to have with us Professor Dennis Chang. Dennis is a pioneer figure in Australia, and he is from Western Sydney University and from the National Institute of Complementary Medicine Health Research Institute, where he's the director in Australia. And we are so pleased to have Dennis with us to share with us the experience of Australia in training and regulation of traditional and complementary medicine in Australia. It's very interesting to learn from various experiences when you go to different parts of the world and see how a Western medicine can be combined in a very evidence-based manner based on research and finding to help people and reach out the communities in order to make a difference. And I'm sure Dennis can address some of those challenges and the way that they have done this training and regulation for T&CM, traditional and complementary medicine in Australia. Dennis, thank you very much. I know this is almost midnight in Australia, and you were so kind to join us remotely, and so happy to have you with us. Please, floor is yours.
Yeah, thank you, Mia, and good afternoon, everyone. So it is a shame that I wouldn't be able to come in person. So, but I'm still would like to take this opportunity to share some of the Australian perspective, especially in the areas of training the workforce and regulation of integrated medicine in the second half of my talk later on. So I'm going to give you an example as to how we actually implement this integrated medicine model in Australia. The Australia is the acceptance of a complementary or T&CM in Australia is among the highest in Western countries. Every survey actually indicated that there's more than 70% of Australians using some kind of a complementary medicine product or services at least once a year. So we do have 8 million regular users of complementary medicine product or services, even though this might not be a big number to country that have more population than Australia, but it is significant given that we only have 23 million people in Australia. So lots of the product made in Australia in the areas of complementary medicine represent $6 billion industry in Australia, which is almost 50% of the entire pharmaceutical industry locally here as well. So there are like 16 registrable health professional under the national registration scheme in Australia. So I only highlighted those 3 out of the 16 belongs to this T&CM area, including Chinese medicine, chiropractic, and osteopathy. So obviously other T&CM or the integrated medicine professions such as naturopath, Ayurveda, yoga, Tai Chi, and they are more like a self-regulated. They are not part of the national registration and regulation system. So I just want to take Chinese medicine as example. So the regulation of the Chinese medicine was first introduced in the state of Victoria in the year 2000. And then in 2012, and there is a national registration of Chinese medicine. In fact, ironically, this is even earlier than the Chinese medicine registration occurred in China. So we do have the Chinese Medicine Board, national board that actually appointed by the Australian government, actually registered and also regulate Chinese medicine practice in the entire country. So this is the table summarize of the current workforce of Chinese medicine in Australia. As you can see that there's about close to 5,000 Chinese medicine practitioners in Australia. So fundamentally, many of them actually practice both acupuncture and Chinese herbal medicine. So in terms of the primary Chinese medicine education training course in Australia, we do have a very long history of that. The first T&CM school was established back into 1969. So in early 90s and also the late early to mid 90s, there are a whole series of university has actually introduced T&CM into the university curriculum. That includes Victoria University of Technology, Royal Melbourne Institute of Technology in Melbourne, and also the T&CM program was later introduced in UTS or called University of Technology Sydney, and later on in Western Sydney University, where I belong. So from then currently there are 5 university or tertiary education offering Chinese medicine degree courses, including 2 universities, that is us, Western Sydney University, and Torrens University. And the other university I mentioned here, unfortunately, they closed their Chinese medicine programs due to various reasons. And there is also 3 private education institutions actually that also offer Chinese medicine education programs as a primary training program. So in terms of the postgraduate education in Chinese medicine, who actually target more like those other practitioners, such as doctors, physiotherapists, or occupational therapists, who want to add Chinese medicine into part of their practice. So they, instead of doing the primary training, this is the pathway for them, and they can choose to do 1.5 to 3 years or 1.5 year full-time or 3 year part-time to be trained as a T&CM practitioner to add on top of the practice they're doing there. So both my university and RMIT University offer this master degree. Also, we offered research degree in PhD as well as a master of research as well. I might stop it here and then come back later on to talk about more the integrated health practice in Australia. Thank you.
Thank you very much, Dennis. It was very insightful to learn how you're regulating the practice of Chinese medicine as an example in Australia. And we will hear from Dennis in the second round more about the way that you're doing it. Thanks for that. Our next speaker is Professor Mohammad Reza Shamsardakani. Mohammad Reza is the professor of pharmacognosy at Tehran University of Medical Sciences with a background in pharmacy. And currently, he is the head of the Secretariat for Economic Development of Traditional and Herbal Medicine in Iran, which is a strategic body affiliated with the Office of President, which is responsible for fostering the use of herbal medicine and traditional medicine in the country. In Iran, they have a kind of expanded program of training and regulation. So I want to invite Mohammad Reza to talk about how in Iran they regulate the training and the practice of traditional medicine and somehow reflect upon their experiences. Floor is yours.
Hello, everybody. I'm very happy to be among you. The issue I'm talking about is a little bit general issue. However, I started my speech. In order to ensure the safety and health of the population, it's crucial that both the training and regulation of the T&CM practices are subject to careful rules and regulation. Government oversight and monitoring play a vital role in achieving this objective. Firstly, the training of T&CM practitioners should adhere to standardized guidelines and requirements. This ensures that practitioners receive comprehensive education and training in their respective fields. Secondly, regulation of TCM practice is essential to maintain quality standards and protect public health. Governments should establish regulatory framework that outline the scope of their practice, ethical guidelines, and safety protocols for TCM practitioners. Furthermore, government monitoring is crucial to ensure compliance with established regulation. Regular inspection, licensing procedures, and ongoing assessment can help identify any non-compliance issue and take appropriate action to address them. In Iran, just medical doctors can officially visit patients and recommended treatment option. So 16 years ago, a clinical PhD curriculum of traditional medicine, especially for medical doctors, was developed and approved by the Ministry of Health and Medical Education. This PhD program is now offered in more than 10 medical universities across the country, and more than 400 graduates are now offering integrative medicine treatment while being active in education, research, and innovation as well. Besides this clinical PhD program, to become a TCM practitioner in Iran, individuals must be first a medical doctor and then complete a formal education program at a recognized institution. This program covers various aspects of TCM. The curriculum typically includes courses, the theory, and also clinical practice on the treatment method specific to that theory and also method of TCM. So in order to practice TCM legally, practitioners in Iran must obtain a license from the relevant authorities. Regulation of TCM practice in Iran is overseen by the Ministry of Health and Medical Education. Furthermore, ongoing professional development and outgoing education are encouraged for TCM practitioners in Iran. Overall, the training and regulation of TCM practice in Iran aim to safeguard public health and ensure that TCM services are provided by qualified and competent practitioners. In order to make sure that all students who are in the field of medical science are familiar with the concept TCM and learn some basic knowledge on the advantages of integrative medicine, since 5 years ago, a 2-credit course on traditional medicine became mandatory by the Ministry of Health for all students of medicine, dentistry, pharmacy, nursing, and some other majors. In conclusion, in an increasingly interconnected world, the field of traditional and complementary medicine has gained recognition for the potential in promoting holistic healthcare. As we look toward the future, it becomes crucial to establish a standardized training program for TCM education. By drawing upon the experience of the different countries, we can develop a comprehensive framework that ensures high-quality education and fosters global collaboration in this field. By promoting knowledge exchange, conducting comparative analysis, ensuring quality assurance, and fostering international collaboration, we can establish a robust framework that enhances patient safety, facilitates global recognition, and advances research and innovation in TCM. Let us work together to create a standardized TCM education system that benefits individual communities and healthcare system worldwide. Thank you so much.
Our next
Dr.
speaker
Takian.
comes
Dr.
from
Takian.
the civil.
Sorry,
Sure,
I just
yeah.
have to mention some point here.
Go ahead.
Because our speakers are using TCM and T&CM abbreviations. I wanted just to clarify that TCM stands for traditional Chinese medicine, but T&CM which is now used by WHO in all the documents, stands for traditional and complementary medicine, so totally different aspects. So in the speech of Professor Shams, he mentioned TCM. I think he's
Traditional.
Yeah, he meant like T&CM. It was traditional and complementary medicine.
Just,
So
That's right, yes. That's right.
I'm sure you're all familiar with that. That's why at the beginning I mentioned the differences between these to avoid any kind of confusion. And then when it goes to integrative medicine, that's another story. Thank you very much, Mohammed, for this correction. Our next speaker is from the civil society. So I'm so delighted to introduce to you Danielle Alakeja. Danielle, first of all, is an Olympic champion athlete. And she is the climate activist, and she has established a SOLI group, which is a kind of think tank or an NGO for climate change, equity, biodiversity, and things. So we are so glad that we have one of the very young future leader of the global health with us from the civil society. And what she's going to talk is about patient-centered care. She's not going to talk about patient-centered care. She's going to talk about community engagement and why community engagement is very important for traditional and complementary medicine and integrative medicine eventually. When we talk about people, when we talk about prioritization of patient-centered care, we need to empower the community. And empowering community has some rules, and of course the civil society is very crucial in order to reach that. We are so glad that we have Danielle with us. Danielle, please. How we can engage with the community.
Thank you. Thank you very much, Amit, for that wonderful introduction. You did frighten me for a second, though, because I heard patient-centered care and I went, that's not in my notes. No, but, and thank you also to the organisers for having me on this panel. It is, I'm going to say, wonderful to see myself, but also it's lovely to see the inclusion of more youth voices as we move through the summit. I will go on and on and on in the second half of this session about how important it is to bring the youth to the table when it comes to issues across the board, both climate and health, which is where the main intersection of my work lies. But to talk about communities and community engagement and how they could be more involved in this process as we attempt to integrate traditional and complementary medicine with what we consider more conventional Western systems. I'm gonna take the actual wording of the question and flip it a little bit, because I think we've got a bit of a false beginning here to the narrative. Communities, I don't think, need to be more involved. Thank you. There we go. Of course, the young person on the panel would have an issue with technology. Communities need to drive this process. And at the end of the day, local communities and practitioners of traditional medicine systems are the heart and soul and the driving force of what we are trying to accomplish here. Oh, we are really struggling today. I tell you what, I'm going to move that. Can you hear me now? As far as I know, my dad is listening online, so if he can hear me, that would be ideal. But as I was saying, you know, local communities and practitioners are the heart and soul of what we're trying to do here. That is how we improve access to healthcare. That's how we achieve UHC, is by bringing not just healthcare to the people, but by fostering environments and creating environments in, you know, what may be particularly unforgiving circumstances such as hospitals. I don't know many people who enjoy going to the hospital. But if we create these environments where people have an element of choice and they have the ability to walk in through those doors and say, I've got a problem, you know, I'd like to approach this the way that I'm comfortable within my own culture, within my own beliefs. And is there a way that we can work with technology and then with traditional medicine practitioners to make that happen? So, and I think Dr. Sharma she's brought up so many incredible points here in terms of, you know, be it research into T&CM practices, be it working with, we've heard from people working with regulatory bodies and establishing regulatory practices. But I think for me, the key aspect here with talking about this community engagement is allowing people that choice. And I'll talk a little bit later about, you know, the respect of individuals and the respect of choice as it comes to a myriad of problems that we're facing around the world today. But specifically in relation to this, Amir used a lovely word in his introduction, and he said nurture. And that really stuck with me. And I think I'm now going to frighten myself and say, in terms of patient care, we need to focus on nurturing, and we need to focus on that comfortable aspect for people when they are in pain, when they are hurt, when they are confused and they don't know what's happening to themselves. How do we nurture them? How do we create that system that is nurturing? Now, in terms of my own personal experience with dealing with community engagement, I had the privilege of being involved earlier this year at WHO's Global Traditional Medicine Summit in Gandhinagar, India. And it was an incredible convening. And I'm going to go on like a young person on social media here a little bit. But one of the most important things at that summit for me was seeing that marriage of practitioners who you weren't, at least for me personally, coming from living in the United Kingdom, being raised in Fiji, of Nigerian parents, all these places that have traditional medicine systems, but that are not typically visible. And so to see with an organization such as WHO, to have them being brought to the forefront and having their contributions honored, I think is the best way to put it, in equal measure as, these incredibly fancy technological solutions that we keep coming up with and we keep innovating. That, to me, I think, symbolized one of the biggest shifts for traditional and complementary medicine. And so I'm going to leave it there before I start to shoehorn climate change into the conversation, which I will do later, so don't worry. But thank you.
Thank you. Thank you very much. This is the end of the first round, and we are very keen to keep it as a workshop and not as the kind of monologue from the panelists. So now it is your turn. If you have any questions, any points, please just raise your hand. Colleagues will be circulating the microphone. Introduce yourself and tell us where you come from, and then raise the question. And if the question is for someone special, just mention, otherwise I will distribute the question to the panelists. Any points, any comments, questions? Yes, please.
Hello. I'm Dr. Anati from Tehran University of Medical Sciences. My question about how we can make equilibrium between traditional medicine and modern medicine. Some people from the modern medicine are against traditional medicine, and the reason for that for them is they say there is no enough document evidence to support traditional medicine. Thank you.
Thank you much. This is a very crucial question, and whenever you go to the literature of the traditional and complementary medicine, you can see that. I'm keen if there's any other questions, then we can circulate others. Any other questions? Yes, please, ma'am.
Thank you very much. My name is Magdalena Leitner. I speak on behalf of the IFMSA, International Federation of Medical Students Associations. And I would like to know how you would implement traditional T&CM in the medical curricula of countries that are not familiar with this concept, or where it's still a foreign concept. And thank you.
Yeah, how we endorse this in the curricula of countries which are not very familiar with that. There is a lady here on the second row. Yeah.
Hello, and I am Marwa Sandhu from National Institute of Health, Pakistan, and I am pharmacist by profession and currently working as scientific officer and drugs control in traditional medicine division. So I do not have any question. I just want to make a statement right here, right now, because the division was named with the WHO initiative, because at that moment when our drug division was redesignated as drugs control and traditional medicine division, there had been a great focus on traditional medicine in Pakistan with regard to WHO, and we still have all those memories on our walls and everything. And there had been quite a few projects regarding traditional garden and things like that. But unfortunately, yes, I must acknowledge what Shamia said, that for some reason, in past years, we have seen that this had gone out of focus from WHO, and I'm really glad to see, and I'm really honored that I have chosen the right session. I should be here right now, actually witnessing that finally it is again to the focus. And recently, I have completed my PhD in pharmacology, and again, my topic was traditional medicine for Alzheimer and dementia. And I can say, based on my results, that that is a quite promising area where we need to focus more. Thank you so much for listening.
Thank you for your comments. Yes. There is a gentleman, two gentlemen actually, at the back. Yes, I will come to it. We take another couple of questions, and then if there's a time, we go back to the second round of questions as well. Please be very brief. Yes, please.
My name is Johannes Stellmann. I'm working for the Software AG Foundation, and I have a question, especially to you, Shyama and Dong. Is there any international coordination on a paradigm level to coordinate the activities concerning regulatory affairs and scientific affairs? Are there specific methodologies how to prove, and are there different RCTs for the specific belongings of integrative medicine? Not on an operative level, this is national, but on a paradigm or principle level.
Thank you very much. Very important question. Yes, gentlemen.
Thank you. My question was close to that. My name is Salim Nakweira with International SOS, and this is interesting because I used to practice pharmacy a few years ago. But my question is to all panelists, are there areas of practice where you see traditional and complementary medicine almost growing a body of standard practices that could be shared across maybe different regions, or that knowledge being more curated, not to avoid exploitation of communities or any negative perceptions that, you know, the consumers may have around traditional and complementary medicine. Thank you.
Thank you very much. Let us go to the first round, and if we have time, then we come. I know there are some other questions, then we come back to. Perhaps we can ask the last one, the gentleman in the middle, and then.
Maybe we mix up the questions. It's better to answer some questions than.
Yeah, this is the last one, and then we.
Thank you very much for this important topic about this traditional and integrative medicine. My name is Waka, originated from Ethiopia, but living here in Berlin and doing immunology. And I am one of the person who profit from this natural medicine in Ethiopia. So it's not enough to talk about traditional medicine, integrative medicine, or traditional Chinese medicine. There are also another terms, which is called natural medicine, phytomedicine, cultural medicine. So I'm very happy to incorporate these terms also, and taking part by WHO, and then bring all together for a benefit of the people.
Thank you very much. So let's, Dennis and Mohammed Reza, please join us in answering those questions. Who wants to go for the first question, which was about the countries who are in denial, and it's very important. Perhaps the first one was the environment, and actually how we can make the environment ready for that, and then international challenges that we have in terms of people who are against this. So many specialists, many doctors are against that. Who wants to go first, and we can nurture that? Hossein, please. Feel free, others can jump in as well. Yeah.
Okay, thank you very much for this interactive session, and thank you very much, Amir, for moderating this panel. So for the first question from Professor Qanaati, I have to say there are some words we need to agree on the concept of these words. Modern medicine is talking about evidence-based medicine, and we all agree because we are all somehow first in the field of modern medicine. But what does evidence mean? The evidence has some different levels, and evidence has a special meaning. So usually there is a lack of knowledge, first of all, a lack of agreement on the concepts that some modern medical doctors, they are against traditional and complementary medicine, and they say that it is not evidence-based. there are some research works doing on different methodologies, and they are showing that we have different concepts of evidence. When a method of treatment exists, for example, for thousands of years, and it doesn't fade out, it still exists, and people are using more and more. You saw some very amazing statistics, for example, from Australia. 3 out of 4 people, Australian people, they are using traditional and complementary medicine at least once a year. So if this modality is not effective, the people, they can put it aside and don't use it anymore. Or a treatment modality, if it has some side effects and it has some like severe consequences, they put it aside. So this is an evidence, and it is proven that when a modality is used, for example, for thousands of years and it still exists, this is evidence. Apart from this evidence, there are also more and more evidence being produced during recent decades, like 2 or 3 decades, recent 2 or 3 decades. So we have ISI indexed journals just on traditional and complementary medicine. We have a journal is called Acupuncture in Medicine, and its impact factor is now around 5, I think. So we have, and several of them, tens of them. So it means that there are different concepts of like the meaning of evidence, and in terms of modern meaning of evidence, we have evidence also. So I think his concern, which is an important concern, needs to communicate. We need to communicate more and more. I think some kinds of sessions like this, high-level sessions, it can bring to the audience that we have like evidence, and this should be as another, like the second question was from our dear medical student, I think. So you see the medical student, they are asking for integrating some training into their curriculum.
Thank you very much, Hussein. So, shall we go to the research question, or you go to the difficult in countries we're not necessarily familiar with that?
Maybe I can answer a bit of both.
Please.
And I should start by saying I am not an expert or trained in traditional complementary or integrative medicine. My field is really public policy, and my role is in terms of establishing the center. So it was a huge learning curve for me in terms of understanding this field. And as I said at the summit, I was very honored that after 2 years, I'm actually now considered part of that community. But as Danielle,
you're nurtured now.
I'm nurtured, and I feel, and I'm using the words from Danielle about this atmosphere of honor and respect. And I think this came out very strongly in the policy analysis, where that was presented at the summit, that if you actually look at the basis of classic medical texts or scientific texts, those were based on traditional medicine, whether it's from Persia or from China or from India or from Africa. And then, I'm just talking analytically here, during colonial rule, a lot of the new laws and policies started, the terminology then was used even as witchcraft, or even though the knowledge, the resources, the plants that were being used for medicines. Even we talked about polio eradication yesterday at yesterday's Virkel, where the mistress of ceremonies was there for the, and that the variolation started, whether it's in Iran or in Turkey or in China and India, as a start of the vaccine, but we never talk about this. And I think learning about the history with respect is very important. And then understanding why certain terms are used, for example, what you're saying, but also in terms of evidence, where we looking at science critically to say, okay, data are generated through some sorts of scientific method, But evidence then is the interpretation and application of that data, and it can vary. You can look at the same data sets and have different interpretations. But I'll also combine now this with Jon's question about the methodologies, therefore. One of the first steps that WHO is doing, and we should have the results early next year, is an evidence mapping. So it's really looking at all the research that's being done in this area. And some regions have already done this. But what we are finding is that the studies themselves, for example, during COVID, WHO has a database of all the research done. But it's not unusual only for traditional medicine research, but other research as well, that the studies were not conducted at a level of quality, power, sample size, methods that were able to give conclusive interventions. So it's not unique to traditional medicine, but we didn't really come out with any interventions as such that were shown to be effective through those studies. But we do need new methodologies. This is what we are finding, that we are not, as I said, okay, we take an RCT, and it's designed for pharmaceutical research, one active molecule, whereas if you take just, say, turmeric or basil, you have hundreds of active ingredients in that, and if you combine it with all our pharmaceutical colleagues here, you combine it with milk or you combine it with oil, and it has totally different, interactions. So understanding how things work, I think this is very important. What is interesting is with genomics research, for example, and personalized medicine on that level, on artificial intelligence, where we've commissioned some work from WHO. For example, say low back pain and acupuncture or yoga, and looking at what are the causal mechanisms. And also then linking to biodiversity, we find that in terms of planetary health, and this is different kinds of research, what the First Lady of Turkey said, we talk about pathogens coming from very local contexts. Why can't we think of solutions as well as arising from those local contexts as well? And how do we understand them? And sometimes the traditional medicine practitioners, the indigenous communities, are those who know what plants and resources grow where, how does it maintain the biodiversity. So I think we're opening up whole new fields of research. I'm not sure we have all the answers, but please, if any of you do and are engaged, it would be wonderful to combine and co-develop this field again.
Thank you very much. Any of you have any burning point to add? Because we need to move to the second round. I'm sure Dennis, as the first speaker, will be touching upon some of your questions with regards to the countries and the challenges that they might have. Any burning points you want to add? Dennis, Mohammed, any point you want to add for the questions?
I probably will address some of the questions during my talk anyway.
All right. So. Okay. With that, thank you very much for your contribution. Let us go to the second round, and hopefully if you have time, we can, because some of these questions will be accommodated in the second round, which is more about the challenges and the ways forward. So let us start with Dennis. He mentioned about the experience that they have in Australia in terms of regulation, training, and mechanisms that they have used. But of course, this hasn't been without any challenges. And those challenges are, for instance, how others believe in the system, financing, and the other things which come in the mind, economic issues, the insurance and other things, in terms of achieving and including those services into the benefit package for the population. Dennis, could you tell us more about the challenges you face and how, in terms of training and regulation, and how you manage those challenges?
Yeah, thank you. So I probably have a slide I want to share. I think I'm already in share mode at the moment, so maybe someone needs to turn that on. So still see myself not on my slide.
So colleagues, could you make sure that he has access to slides?
Yeah, I might start talking.
Yes, please.
So fundamentally in Australia, the integrated medicine practice is currently still in its embryonic phase, as probably similar situation in the rest of the world. So most of the so-called integrated medicine consult was actually happening at the private clinic level. There's not, I know in China, for example, Chinese medicine is practiced in hospital level, but unfortunately not so much in Australia, and I believe there is very little in Western countries as well. But I just want to highlight two areas, and that indeed there are some integrated medicine practice happening in the hospital level, that is integrated oncology as well as women's health. So those are the two areas gaining popularity. For example, in Australia, there are a couple of integrated medicine centers being part of the hospital, such as the Chris O'Brien Lifehouse in Sydney, Peter Mac Center in Melbourne, so where they are major like a cancer hospital, but they do have integrated oncology center in there where people treated with some all those interventions other than chemo and radiotherapy as a conjunct therapy. And similarly in women's health, in some community center in hospital as well, there is a women's health issue has been dealt with integrated interventions such as for endometriosis, dysmenorrhea, infertility, etc., etc. There are also a handful of medical doctors themselves are trained in complementary medicine. For example, some people might train as acupuncturists. So naturally, they will add acupuncture into their practice in addition to what conventional intervention they are going to give to patients. There are quite a number of associations, including the Royal Australian College of General Practice. They do have integrated medicine special interest group, as well as Australasian Integrative Medicine Association, AMA. So those are the association formed by the conventional medical doctors, and they with special interest in integrated medicine, where they offering some kind of professional development courses to their members as well, which is very encouraging in that sense. I just want to share one of the examples we have at Western Sydney University. So recognizing the need for bridging the gap and to collecting more evidence to support integrated health practice, we actually established the Australia first university-based integrated medicine center, where we have a GP-led multidisciplinary team to practice integrated practice, including herbalists, acupuncturists, and yoga practitioner, remedial subject therapists. And those are the complementary medicine practitioner actually really work with the conventional general practitioner and to see patients together. So this is the model of the care we try to implement within our Wish Clinic. So in fact, this model of care is based on the similar model in Northern America universities such as Harvard and Stanford. So where we basically have a patient coming in to see the center GP first, the general practitioner first, and then the GP will liaise with other complementary medicine practitioner to design a treatment plan. And this treatment plan also taking into account the personal beliefs and the preferences of the patient as well. So in doing so, we basically bring in patients and being treated in Western with medicine supplemented by conventional, by complementary medicine intervention. And then we collecting data behind the scene. And the aim of that is to compare the health outcome between this integrated health practice versus the conventional healthcare model in order to see whether that will offer additional benefits to patients in terms of their patient health outcome as well. So, so as Amir alluded to that, I just want to briefly talk about the challenges and which maybe partially answer some of the questions the audience asked in the first round. So there are quite a number of challenges in integrated medicine practice, at least in Australia. there is a lack of recognition, awareness of integrated medicine services, and because the government doesn't actually recognize that formally in the Medicare system, for example, and the General Practitioners Council will be funded by Medicare, but all other complementary medicine treatment, yoga and herbal medicine, they are out of the pocket expenses for patient. That actually raised huge issues in terms of affordability of that. So of course, some of the patients can have the private medical insurance, which can partially subsidize the cost, but still there's lots of out-of-pocket expenses. And there is a lack of a training of integrated medicine practitioners, and fundamentally, even though I mentioned there are some professional development courses done by those associations, but there is very little integrated medicine content in the medical curriculum at the moment. And there is also lack of scientific data and what should I say, probably evidence. We mentioned about the evidence just a couple of minutes ago. So also there's a lack of guidelines, and to those the practitioners really interested in complementary and integrated medicine practice, but there's very little clinical practice guideline in that area. So that actually leads to some of the bullet point I got here in terms of the future directions. We do need to do more research to prove the additional benefits the integrated health practice could offer to patients. Obviously, we talk about the research method and how best we can tailor the research method to suit the complementary and integrated medicine research. We do need to put in a lot more effort to develop evidence-based guidelines. And advocacy is another interesting area. We have been recently working, produce an oncology white paper articulating the landscape as well as the challenges and solution and recommendation. We met with the politician in Canberra, which is the capital city in Australia, and to try to bring the government on board, and with the hope that the government could come to the party to subsidize some of the evidence-based integrated medicine practice. So that's the advocacy I referred to here. And also the education of end users, because lots of patients don't understand what is the integrated medicine. They probably don't understand the benefits integrated medicine could bring to them. So we need to educate people as well. And fundamentally, this whole movement needs to have a strong partnership between WHO, government, and local health authorities, insurance, and also the conventional as well, complementary and integrated medicine practitioners. So I stop it there. Happy to answer a question later on.
Thank you very much, Dennis. You had a very comprehensive round of good practices and the challenges you had, and we are a little bit of behind the schedule, so we need to be a little quicker. I did introduce a great colleague of mine, Professor Hossein Ayati. He is the professor of Chinese medicine, and now he is at the Tehran University of Medical Sciences. And intentionally, we wanted to use his insights in the second round. So I'm inviting you, Hossein, to tell us more about the best practices that in traditional and complementary medicine from around the world that we can learn from, please.
Thank you very much. Actually, I want to mention some best practices of integration. And when we talk about integration, we need to be like comprehensive. This integration should be like 360 degrees. So I would like to mention three aspects of integration. First is like integration in education, and I'm very happy that our dear medical student here, she mentioned about the integration of curriculum. So I would like to ask a very quick question. Do you like that? Do you have some training on T&CM or? Not okay, but this question was asked from medical students in Australia, and the paper is published. More than 70% of medical students in Australia, they mentioned that we like to have some knowledge about traditional and complementary medicine. The reason is that in the very near future, you would be a medical doctor, and the patient will refer to you, will come to you and ask you about some kinds of traditional and complementary medicine. So as a medical doctor, you need to know at least some information about the choices of your patients, because they are using traditional medicine, complementary medicine. So you need to be familiarized with that. So there is another, for the best practices, I found a very good paper published like some years ago. They checked the curriculum of 130 medical colleges in USA, and they found that more than half of them, is 55 or 56% of them, it means like around 70 medical colleges in USA, they have established and formal education of T&CM for their medical students. So this is one of those best practices in terms of educations. In China, actually, it's completely integrated. There is a system for like conventional medical doctors. They receive good amount of traditional medicine education, and traditional medical students, they receive very good amount of knowledge in Western medicine. Another aspect is research. We talked about research. We need to be integrated in research. Integration in research means that like we not only need to prove the safety and efficacy of T&CM, we need to compare it with like current medicine and standard care. This is very important. And as Shaima, she mentioned, the methodology is different. The methodology to do research and compare this T&CM with the conventional medicine is totally different. And it should be like quite very integrated. Nowadays, there is a methodology. There are two groups in a RCT. Both of them, they are receiving a standard care, and one group is a standard care plus one modality of T&CM to see if there is additional outcome or not. So, and for this, there are very good examples. As I mentioned, there are thousands of good quality research work almost around the world, very good journals. And the second, and this is my last point, is integration in treatment. Actually, here we talked mostly we talked about this aspect. This aspect is very important, and I think for this aspect there are two major concerns. One is in the governmental level. In the governmental level, as it's mentioned in WHO guidelines, they should make sure that the people have access to safe and effective T&CM as an option in their healthcare system and guidelines, and they are provided and suggested so to have these kinds of treatments, and they can use their insurance for this. So you see at this governmental level, it depends to the policymakers, and it's very good that WHS as a like high level policy maker, which gathers policymakers, address this availability, affordability, insurance, all of them needs like the politicians. And the second is giving like the healthcare services. For that, the integration also is very important. And for that, now we have very good samples. We have integrated, for example, cancer care clinics in some countries. We have integrated obesity care clinics. We have integrated chronic pain clinics. One of these integrated chronic pain clinics is in Munich University. And when a patient go to them, refer to them for chronic pain, he or she can have an option to get almost 20 different modalities of treatment, combination of these 20 modalities for the chronic pain. And they have done a cohort research. It's ongoing, and recently they published after 7 years, they showed that the patients who are coming to this integrative pain care clinic, they have much better results than those who just went to one standard care like painkillers or something there, and then the effect also remained for a longer time. So thank you very much.
Thank you very much. Your examples, and I think by treatment, perhaps you mean all healthcare delivery services, not just treatment, prevention, health promotion, and other public health services as well. Thank you. Wonderful best practices, Hussein. Thank you for sharing us. Let's go to Daniel again for the civil society. Among other things that Daniel does is she is a climate activist. And biodiversity, planetary health, and climate change as the biggest threat to public health in 21st century, we do have some serious considerations when it comes to T&CM. Daniel, could you share your insight with us when it comes to the planetary health and climate change issue and biodiversity and the intersection between that and traditional and complementary medicine?
Absolutely, Amir. I don't think it'll come to anyone in this room really as a shock that the climate crisis is, reaching new heights with each and every day. And as things around the planet do get worse and worse and worse, it's having a devastating effect on our biodiversity. And, to directly tie that in to traditional and complementary medicine, as our environments are stripped to their biodiversity, as we are losing plants and animals and the flora and the fauna of this world, we are losing those raw natural ingredients upon which these practices are built. Now, how does that lend into global health and global health equity? An interesting fact that I learned actually at WHO's Traditional Medicine Summit was that if the global healthcare system was a country, it would be the 5th largest polluter in the world. And I think that's something that we don't think about every single day. We don't think about the packaging, and we don't think about the paper. And even as we make an effort to transition to more, eco-friendly systems, we do have a very, very long way to go as it comes to those things. So the ability to integrate traditional medicine systems into our healthcare systems is, more essential than ever. Part of this, and you'll forgive me, I'm going to abstract up a little bit before I come back down, is we have to change the way that we approach problem solving. And innovation is absolutely crucial to human progress, and I don't mean to denigrate it in any way, but we actually have a lot of the answers that we're looking for. They exist with indigenous populations, they exist all around the world. The key component here is that we have to learn to, and I'm going to come back to respect again, we have to learn to respect practices and opinions and peoples who are different to who we are. Now, I say we here as a hodgepodge of cultures and continents, as you can probably tell. I was born in the United Kingdom, I live there now, but I was raised in Fiji. And so I'm a child of the South Pacific. And as a child of the Global South, I say my family is also Nigerian. The Global South is being battered by climate change. And yet they contribute a minuscule amount to the emissions around the world. Now, when you think about it, climate change is our most crucial health crisis. And I think it is a part of the tragedy of COVID-19 was the progress that we lost on pushing forward on certain climate initiatives. Because at the end of the day, I always, and this is, slightly flippant, but sometimes you have to laugh, otherwise you'll cry. I always tell people that I don't understand why we say save the planet, because we've got nowhere to go. The planet's going to be fine. It's save yourselves. We've never had a space movie that's ended well, so we're not going anywhere. But we need to start to pursue not just sustainable behaviors. So be that this particular session relates to healthcare, but in everything we do, they need to be actively regenerative. We can't sustain the way that things are now. And the biggest question that, I would ask to the panelists, but also to everyone in this room, is that if we sustain and we hold as where we are now, is this a world that we're going to be happy passing on to our children? And I think you'll find most people would say that the answer to that is no.
Thank you. Thanks, Daniel. fascinating insights. Dong, you shared with us the experience that you had in COVID-19, and I am interested if you have some initiatives in China and in your hospital or in the academy that you are a member of in terms of patient-centered care and the way that you are using Chinese medicine for that. Any insight you want to share with us?
You mean patients come here to treat COVID-19?
Yes.
Yeah, a lot of, because.
And the challenges perhaps we have in those kind of environments.
And first, we have challenges, especially in Wuhan. So it's a panic because no one knows what will happen. And very soon we found, since antivirus medicine is not work, so it may be our chance. So that's why it is very hard by using modern medical efficacy evaluation to reflect our clinical characteristics. Because traditional medicine, I think, for example, T&CM, just look the patients this way. What the symptoms? We don't care about what virus inside. We just care about what the symptoms outside. Then we will judge what probably wrong inside. So that is experience and wisdom. So it is very hard to show that. But I'm very proud we did it. And, in 2020, December and November, December, and a large of COVID-19 patients and came to our hospital, and we use traditional Chinese medicine and they recover. And sometimes I think everything has two opposites. And sometimes I feel I should thankful COVID-19 because that make Chinese people recognize T&CM more than before. Okay.
That was an opportunity for China.
Yeah.
Okay, great to hear that. Thank you very much, Dong. And we have a few minutes left, and we have two fascinating speakers who are going to wrap for us before I give you the final remarks. I want to ask Shyama, please tell us, based on all these experiences, the challenges. We have some unbelievers. We have some people who need more evidence and more research. We have the governments who are somehow reluctant to do that. We have some people who don't want to take these kind of things. And you have just held the World Summit, the global summit on that. And I'm sure this has somehow paved the way for the future actions. What are your recommendations for the future?
Thank you, Amir, and thanks all the colleagues. I will highlight 5 main next steps that came out of the global summit and all the work that WHO is doing with all countries and all regions. The first, as I mentioned briefly, is that WHO with governments in all countries, all member states, is doing a survey on what is the current situation related to traditional complementary integrative medicine. So stay tuned, watch this space, that will be published, and I think we'll all learn a lot. The second is that member states, countries have asked WHO to develop a new global strategy on traditional medicine. And I'm using this as short form, so it covers traditional complementary integrative medicine. And this strategy will be from 2025 to 2034, so it's a 10-year strategy. Early next year, there will be public consultations. Already this year, the Director General, Dr. Tedros, held a consultation with civil society. He has these civil society dialogues, and there were civil society dialogues on the pandemic, on AMR, on a range of subjects. And they found that this one was the most highly attended by civil society. And so please engage. Next year, at the beginning of the year, there will be consultations with experts, with students, with civil society, with people. Please provide your inputs to this global strategy. So far it's the survey, the strategy. The third is the global summit was held alongside the G20, and then it was followed up by the BRICS summit. And the G20 leaders' declaration included a commitment to look at the safe and effective use of traditional complementary integrative medicine. And at the BRICS summit, the heads of the heads of states, as their fifth action point, asked for a repository of traditional medicine knowledge. And this is very interesting, a digital repository. One is the co-development of knowledge to see how do we know what we know, and the dialogues with communities. Danielle, as you said, with respect, but really how do we know what works, what doesn't? With indigenous peoples, the free, prior, informed consent. And this is not just a knowledge issue, it's also a legal issue. We had the Director General of the World Trade Organization say that from January, there's actually going to be new patent laws that say if there has been prior use that has been documented, that's going to be a requirement for any patent application. So this will also support that. But also biodiversity, the herbal pharmacopoeia, the evidence-based interventions, the research methodologies. So this will, and I think the clinical trial registry that you talked about as well in China, the platform.
For international.
Yeah. All these things I think we need to, collaborate on.
Yeah.
That would be excellent. Then of the fourth one, and you talked about the chronic pain clinic, in Munich, for example. But the Charité University in Berlin has just had the Integrative Medicine Center approved with Georg Seifert, a doctor in pediatric oncology. And he talks about this as a Dr. House network. Have any of you seen that TV series with, there's this Dr. House and there's this team and there are these conditions that there are no solutions for, and then, you bring different things together. And the idea was to say, can there be reference hospitals in like the one you talked about as well, Professor Chang, in Australia, that can actually look at a set of conditions or patients and say, like the 70 modalities you talked about, can we look at that systematically globally in an integrative medicine network in a way and monitor? WHO now has the International Classification of Diseases. So having standardized data collection across countries for these particular integrative medicine outcomes and processes. And the last one I think you talked about is about a paradigm shift to understand what we mean by health. How do we understand what is a human? What's our well-being, our mental health, our physical health? And also you heard this across the speakers, we didn't coordinate on this 70% come out, 3 and 4, 70% use in Ghana, 70% of patients in Germany, in Australia. I mean, so is our investment in research commensurate with the demand and use? And it definitely is not, but the National Science Foundation and others are now investing billions into this area of work. And I also, and innovation, like we talked about methods earlier, I'll just talk about functional magnetic resonance imaging, for example, where you can say with meditation, actually see changes in, or with acupuncture, changes in neuronal pathways, or with meditation and EEGs, changes in brain function. I mean, there's a lot happening. So I think here it's about integration, yes, but with investment and innovation.
Thank you very much. Fantastic. We have just 4 minutes. And Mohammad Reza, Professor Shams, could you tell us, as the last but not least speaker, I know I'm cutting your time for about 2-3 minutes, what do you foresee and what are your recommendations from the World Health Summit and this gathering for the future fostering, nurturing of this traditional and complementary medicine?
Thank you very much again. I have to short my speech to 2-3 minutes. Uh, by addressing integrative medicine, the World Health Summit is fostering a platform of dialogue and knowledge exchange among healthcare professionals, researchers, policymakers, and other stakeholders. Therefore, we believe that the inclusion of the integrative medicine in the agenda of the World Health Summit is a positive step toward recognition the importance of traditional and complementary medicine in global health. When it comes to recommendation for future action in the field of the integrative medicine, there are a few key points to consider. First, is crucial to emphasize the importance of research. Secondly, promoting collaboration and interdisciplinary communication is essential. Integrative medicine involves a wide range of the healthcare providers, including medical doctors, naturopaths, acupuncturists, and nutritionists, among others. Additionally, education plays a vital role in the future of the integrative medicine. It's important to invest in training program and continuing education for healthcare professionals to enhance their understanding of integrative approaches. As we strive to enhance healthcare system worldwide, it's crucial to explore avenues to collaboration and knowledge exchange. One promising approach is the establishing a consortium among countries with local traditional school of medicine. Countries with rich potential in T&CM like China, India, Iran, Malaysia, South Korea, Hong Kong, Pakistan, and many others possess invaluable knowledge and practices that have been passed down through generation. By forming a consortium, we can collectively preserve and promote this cultural heritage, ensuring their continued recognition and utilization in healthcare system. In conclusion, the establishing a consortium among countries with local traditional school of medicine, along with those interested in harnessing the potential of T&CM, holds immense importance. This is my suggestion. This is my suggestion that the consortium could help to exchange the idea, to exchange the experience, and other things can help to promote these topics. Thank you.
Thank you very much. If you join me in the round of applause for our brilliant panelists and their contributions. Thank you. And another round of applause for you as such a fantastic contributor to the discussions as well, and a good listener. Let me finish by saying this. Traditional and complementary medicine, integrative medicine, has a political ladder to go. This needs change in governance, understanding of the public, advocacy with the policymakers, and this is a kind of global endeavor that very happily the World Health Organization has pioneered and has prioritized and going ahead. So we need evidence. We heard a lot that more evidence is needed. We need practices, best practices to be shared. We need to regulate the practices in a way that these don't harm people. And we need to bring patient-centric care culture rather than system-wide culture. As Hossein said, for instance, if a patient goes to the doctor, it's not just for the treatment, it's for health promotion, for health prevention and other activities. At least a Western medicine or a modern medicine specialist can give some options, some clues to the patients that if you want to go to this is your option. And last but not least, we need to train our workforce. Of course, you very heartily mentioned that you don't like it. But eventually, we reach a situation that if the majority of people in Australia, 3 out of 4, wants to have, and they spend a lot on traditional medicine, that's why we need to have a mechanism. So of course, it is a long way to go, but many mechanisms are now on track. So perhaps establishing a consortium of countries working together, facilitated by WHO, Shyama, and I'm sure you appreciate and you help those countries is very important. And I hope that this is just the beginning in the World Health Summit, and then this become one of the main disciplines in the World Health Summit to be discussed, to be advocated, and to be reached for universal health coverage. Thank you very much. The opening ceremony is very close. Please enjoy that. All the best.